Okay, hello again. Thank you all for joining us for this webinar. We're really excited about this new version of the core competencies for public health professionals and the opportunity to share it with you and to have some discussion around it and hear your thoughts and your questions and your comments and any ideas as we move forward with this work. So I just wanted to start off with a little bit of housekeeping like we do at the beginning of every webinar pretty much, but just wanted to make sure you're aware that all participants in today's webinar are currently muted, but we should have lots of time for questions and discussions, and we hope you'll jump right into that with us. As we go through the webinar today at any time, please feel free to use the chat box to ask any questions, share any comments, and when we get to the discussion part, please also feel free to raise your hand if you'd like to ask a question out loud. Also, if you have any technical difficulties or anything like that with the system today, please don't hesitate to send us a note in the chat box and we can help with some troubleshooting. The slides for today's webinar are available and we'll put the link to those in the chat box. So if you'd like to have a copy to hold on to or to access any of the links that we share today, you can do that. And we just also wanted to let you know that the meeting is being recorded and we will be sharing it following the live event. So I wanted to start off with a quick round of introductions. So my name is Kathleen Amos and I work at the Public Health Foundation as the Director for Academic Practice Linkages. And I'm joined by several colleagues here today, both with the Public Health Foundation as well as with the Council on Linkages between academia and public health practice, who work together to support the core competencies. So I'm just going to ask each of them to quickly introduce themselves, and I will start with Ron.
Hello all, I'm Ron Bialik, President and CEO of Public Health Foundation and Director of the Council on Linkages, and just delighted that all of you can be with us today. Abdullah.
Hello everyone, thank you for joining us today. My name is Abdullah Takir and I'm a Project Associate for Academic Practice Linkages at PHF. Grace?
Hello everyone, my name is Grace Davis and I'm an intern with Academic Practice Linkages with PHF, and we're really happy to have you here today.
Fantastic. Thank you so much. We are also joined today by the chair of the Council on Linkages between academia and public health practice. So I'll ask Bill to introduce himself.
Yes, hi, I'm Bill Keck, and Kathleen's already introduced me. We're just delighted to have this new version of the competencies available, and I hope you'll enjoy the webinar today.
Thanks, Bill. And also within the umbrella of the Council on Linkages, we have a core competencies work group that provides guidance and support for all of the work that happens related to the core competencies. And we're very pleased to be joined by our co-chairs of that work group today, who I will ask to introduce themselves as well, starting with Amy.
Hi, my name is Amy Lee, and I'm professor in the Department of Family and Community Medicine at Northeast Ohio Medical University and program director for the Consortium of Eastern Ohio Master Public Health Program. And I was honored to be one of the co-chairs. And for any of the subcommittee group members who are out there, thank you so much for your work on this. Tremendous amount of work that you all put in, and just honored and privileged to be a part of it. Janet?
Yes, hi, I'm Janet Place, and I'm the Director of Practice and Workforce Development for the Arnold School of Public Health at University of South Carolina. And I've been involved with the competencies for a long time, and I'm really like, I'll echo what Amy said. Just this whole effort to update has just been spectacular in terms of input from so many people and just really moving forward, and it's exciting to be part of it.
Awesome. Thank you so much. Yeah, we are really thrilled to be engaged in this work, this whole team that supports the core competencies. And owe a huge debt of gratitude and giant thank you to all the members of the Core Competencies work group who participated in this process as well. I also want to say a great big thank you and acknowledge Liza Corso, Doha Madani, Michelle Carvalho, and really everyone at the Centers for Disease Control and Prevention for their support throughout this revision of the Core Competencies. All of this work that we're talking about is funded by CDC Center for State, Tribal, Local, and Territorial Support, and we are incredibly grateful to have that support and engagement, as well as interest and engagement from a number of other centers and offices across CDC, as well as with the Health Resources and Services Administration. So thank you, everyone. As we went through our introductions, we mentioned two groups that I just wanted to say a few words about, one being the Public Health Foundation and the other being the Council on Linkages between academia and public health practice. So the Public Health Foundation, for those of you who aren't familiar with our organization, is a national nonprofit organization. We're based in Washington, D.C., and we exist to serve the public health and population health workforce. Our mission is to improve public health and population health practice to support healthier communities. And we do this by providing capacity building assistance in the form of resources and tools, training and technical assistance for the workforce. Our work is focused on organizational development and performance improvement, and specifically in the areas of quality improvement, performance management, and workforce development. And one of the major efforts within this focus on workforce development that we work on is providing the convening and staff support for the Council on Linkages between academia and public health practice. So the Council on Linkages is a consensus-driven collaborative made up of 24 national organizations engaged in public health that works on initiatives that are designed to benefit the workforce broadly. The Council on Linkages has been around since 1992 and aims to improve the performance of individuals and organizations within public health. And as you can see on the slide, the members of the Council on Linkages span a variety of federal agencies and professional groups in public health and population health. The Council on Linkages is currently focused on two major initiatives, the Academic Health Department Learning Community and the Core Competencies for Public Health Professionals that we'll be discussing today. So now that you know a little bit about us, we'd also love to hear a little bit about you as we get going. So we do have a couple of quick poll questions, and Abdullah will pull the poll up here. But we're curious to know what type of organization you're joining us from and what your experience is working with the Core Competencies, whether you've used them before. So you guys are on it, but we'll give people a few seconds to fill that out. And if the poll doesn't work for you for whatever reason, please feel free to share your answer in the chat. Or if your answer is other, please feel free to let us know or let us know how you're using the Core Competencies. You can see that quite a few people are using them. So we always love to hear a little bit about that too. Okay, looks like we're about done. If you want to close the poll and share the results. So it looks like the largest group of people joining us today are from local health departments, about 60%. And then about 17% of the audience from academic institutions and about 14% from state health departments. Awesome. And about 60% also are using the Core Competencies, currently with another 12% who have used them in the past. Fantastic. Thank you so much. Well, there's our second poll question. So with that, we wanted to dive right in, and I'm going to start off today with a little bit of an introduction to the 2021 Core Competencies and kind of what that looks like and how the feedback came together to shape the changes that you see in this new version of the Core Competencies. And after that, we should have lots of time for questions and discussion, and we really do look forward to hearing your thoughts, any reactions to the changes that we're talking about, or how these changes might impact your use of the Core Competencies. So please feel free to share your questions, your comments, your suggestions, anything like that throughout the presentation in the chat, and we'll dive into those when we get to our discussion. So one long-standing initiative of the Council on Linkages is the Core Competencies for Public Health Professionals, which are a set of competencies designed to reflect foundational or cross-cutting knowledge and skills for all public health professionals, whether you're engaged in the practice of public health, education, or research. The Core Competencies have been around now for about 20 years, since 2001, and they're used in workforce development activities across the country. The most current data that's available shows that around 80% of state health departments are using the core competencies, about 60% of tribal health organizations, 45% of local health departments, and 25% of territorial health departments, as well as a majority of academic programs with a public health focus. We do know from this data that's collected on use of the core competencies that the core competencies get used for a variety of different functions within public health workforce development, including to guide development of job descriptions and performance objectives, competency assessments and training needs assessments, education and training to build skills and competencies, workforce development plans to help ensure a skilled workforce, other competency sets and tools and other resources to support the activities and growth of public health professionals. The core competencies can also be found in major national initiatives such as Healthy People and accreditation. So for those of you looking at Healthy People 2030, there are objectives within the public health infrastructure topic area that relate to increasing the proportion of public health agencies that use the core competencies in continuing education for their personnel. The Public Health Accreditation Board and its accreditation standards for health departments incorporate the core competencies into Domain 8 of the standards and measures, which is related to workforce development and requires the development of a workforce development plan that includes an assessment of staff competencies. And the core competencies is given there as the example of a nationally adopted competency set that could be used for that purpose. For schools and programs of public health, the Council on Education for Public Health used the core competencies in developing its foundational competencies that you see in its accreditation criteria. And the core competencies are also integrated into the Train Learning Network, the largest learning network designed specifically for public health professionals, so that learners can locate courses that will help build desired knowledge and skills. And finally, the core competencies have long been designed to reflect the knowledge and skills needed to deliver the 10 essential public health services. So as you likely know, and hope this is why you're here, the core competencies have been under revision over the past year. And we recently, at the end of 2021, completed the revision process and released an updated version of the core competencies. This is a kind of a regular process for us. The core competencies are regularly reviewed and revised to keep pace with changes in the field of public health and ensure they continue to meet the needs of the public health workforce. So as I mentioned, the core competencies were first released in 2001, although they were preceded by a set of universal competencies. And they are currently on a 3-year review cycle. So every 3 years, we consider whether revision is needed. The core competencies have been revised 3 times now, with the current version being completed in October of last year. So I just wanted to share a little bit about the revision process and the input that led to this revised version of the core competencies to kind of provide some context for the changes that you see in this new version. So the revision process is laid out on the screen here, but it involved a number of stages that took place over about a year. Including 2 open comment periods to hear feedback from the public health and population health community on the core competencies to inform revisions. That feedback was organized and shared with the core competencies work group, which, as we mentioned, guides work related to the core competencies and is made up of practitioners, academics, and others from across the country. And major areas that needed to be addressed were identified. The feedback was used to develop a preliminary draft of revisions, which was released publicly in June of last year. And then feedback on that draft was used along with additional guidance from the work group and numerous workforce development resources to further refine their revisions. And all of this led to the development of proposed revisions to the core competencies, which were sent to Council on Linkages members for consideration and adoption. So as I just mentioned, the revision of the core competencies is really heavily informed by the public health community. Feedback on the core competencies is welcome, and we do receive that feedback on an ongoing basis. But the open comment periods that we had during the revision process really allowed some dedicated space to hear additional feedback. During both open comment periods, feedback was welcomed by email, online through public website comments, as well as an anonymous comment box, through social media and during virtual meetings, including 22 virtual town hall and other meetings. These efforts led to more than 1,500 engagements with the revision process and really significant and really valuable feedback that was instrumental in revising the core competencies. So again, a great big thank you to everyone who engaged in this process and shared their thoughts and ideas with us. As part of this process, we also took suggestions and we gathered literature and other resources to inform the revision, which amounted to more than 120 resources. In terms of what we heard in the feedback and how that led to changes in the core competencies, among a variety of points, feedback at a high level really highlighted, I think, a desire for better harmonization among efforts that impact the workforce and workforce development, a desire to add content in a number of topic areas, as well as a desire to make it easier to use the core competencies. And these points were addressed in several ways. So first, to address the desire for increased harmonization with other workforce development resources, numerous resources used in public health workforce development were consulted, and we worked to align concepts and wording as we were making revisions. So these included things like the 10 essential public health services, Public Health 3.0, the Public Health Accreditation Board's standards and measures for health department accreditation, the Council on Education for Public Health's accreditation criteria for schools and programs of public health, the domain areas that are used in the Certified in Public Health exam, the strategic skills for the governmental public health workforce, and other competency and skill sets. In addition, the core competencies work group worked to identify resources related to concepts within the core competencies, and we're planning to continue to work on that area and create links to resources that will help supplement the content that you see in the core competencies. Feedback received about content that was missing or perhaps not well addressed in the core competencies led to the addition of new content as well as adjustment of existing content to better address those needs. So probably the most significant changes in this area relate to health equity and management and finance. So for those of you who are using the 2014 version of the core competencies, you'll remember that there is a cultural competency skills domain. That domain was transformed as part of this revision process to focus more on health equity, and additional health equity content was woven throughout the other domains. As well, the domain focused on management and finance still exists, but it has been reorganized and expanded. Other major areas of focus in this part of the revisions included environmental health and justice, emergency preparedness and response, policy and advocacy, and communications. The request to make the core competencies easier to use also led to a number of changes in the revisions. And these are probably the most obvious changes when you look at the new version of the core competencies. So the core competencies were reorganized into a new structure and simplified. So this new structure includes a set of competency statements that are meant to apply to all public health professionals. And those have been simplified by working to reduce jargon and trying to eliminate unnecessary or overly complicated wording. This new structure has enabled a decrease in the number of competency statements from 92 in the 2014 version to 56 in the 2021 version. It does, however, retain the 8 domains and the 3-tier structure that you're familiar with. Second, to assist with use of the core competencies, sub-competencies were added underneath the competencies that articulate more detailed knowledge and skills for individuals with responsibilities related to each of the 3 tiers. So having fewer competency statements combined with adding these sub-competencies, the hope is that this will better support both users who prefer a more general view of the knowledge and skills in the core competencies, as well as those who desire a more detailed view. Third, as I mentioned a minute ago, resources will be linked to the core competencies to help supplement the content, and examples which appear in the core competencies as EGs have been updated to provide additional context. We also plan to continue adding to and updating these resources and examples over time to help transform the core competencies into more of a living document. And finally, we're working on putting the core competencies online in a format that will provide options in terms of how you view the core competencies. So right now they are just in PDF form, but we're looking to build out more of an interactive form that will allow you, say, to only see the competency statements without all the sub-competencies, or to look at all the detail, but only for a single tier, things like that, to be able to kind of manipulate your how you're viewing the competencies. So I'm not going to go through, obviously, the whole competency set, but I did want to briefly preview a few of the high-level changes in this revised version of the core competencies. So first, there are some changes to the domain names. 5 of the domain names have changed in some way, although in most instances, this does not reflect, I don't think, really significant changes to the focus of the domain in terms of content. The biggest change, though, as I mentioned a second ago, is this movement from emphasizing cultural competency skills to emphasizing health equity skills. In addition, the revised version of the core competencies contains some minor changes to the tiers and how those are defined. So principally, these changes reflect a desire to shift from a focus on categorizing an individual as being at a certain level to focusing on different types of responsibilities that people have within an organization. As we've got a lot of feedback about how individuals often have responsibilities in different areas of their jobs that cut across the tiers, and it's not so easy to kind of slot someone into a particular tier. We have also removed the emphasis on entry level from tier 1 and better highlighted program support responsibilities. So the next couple of slides just have a couple of screenshots that show the current 2 main views of the core competencies. So first, this view here shows only the 56 competency statements organized into the 8 domains. As I mentioned, priority was really placed on reducing the number of competency statements and simplifying the wording to try to make it easier to use the core competencies. We've heard for quite a number of years, particularly from health departments, that the core competencies can sometimes be really long and complicated for the kinds of activities in which they're trying to use them for. So we hope that this makes a difference. This decrease in competency statements from 92 to 56 really represents a significant effort to try to address those needs better. And this second view just is kind of your complete view of the core competencies, shows the competency statements along with the sub-competencies and examples, again, organized into those 8 domains and 3 tiers. So this view is what you would look at if you wanted that more detailed information about specific knowledge and skills for each tier, as well as examples to help provide additional context for the competency and sub-competency statements. So that final revised version of the core competencies is available online, and we are turning our attention to providing support for transitioning to this new version. So we recognize that it's not enough to develop a competency set and that there are a lot of pieces that really go into the implementation. So we're now starting to focus on the variety of resources and tools that can help organizations and individuals implement the core competencies. These resources and tools primarily fall into 3 buckets. So first, as we do every time there's a new version of the core competencies, we are developing resources and tools to help with the transition from one version of the competency set to another. So for example, we're currently working on a crosswalk showing how the specific statements within the 2014 and 2021 versions relate to each other. So kind of mapping those 2 together. So you can see, as you're transitioning your assessments and your other work, kind of where a concept went in the new version of the core competencies. And as a corollary to this, we are working with our train team to update the version of the core competencies that's embedded in the Train Learning Network and to map all the existing courses that are tagged with the 2014 version of the core competencies to this new competency set. We've also heard from a number of people that some kind of short video or slide set or something like that just gives a brief introduction to the core competencies that people could then share with their staff or their colleagues as they're doing workforce development activities would be really useful. So we are beginning the process of putting that type of resource together. Second, we are updating existing resources and tools that support use of the core competencies to reflect the changes that have been made in the new version. So we have a number of resources that are currently available or have been available for several years for using the core competencies. And so we're going through the process of looking at all of those and figuring out what changes need to make so that those resources are still useful and relevant and reflect the current version. So we have begun this process with updating the existing competency assessments and recently finished updating a version of that assessment instrument based on the competency statements found in the 2021 core competencies. So that is now available, and I think we could probably put the link in the chat box if anyone wants to look at it. But so that one's now out, and then we're just at the very tail end of finishing up additional assessment instruments that are specific to each of the 3 tiers. So there will be one general one as well as one for each of the 3 tiers when we're done. We're also beginning to work on updating a crosswalk illustrating how the core competencies relate to the 10 essential public health services. So again, that's something that has existed for a long time and been updated over the years. So we will update that to the current version of the core competencies, as well as a set of FAQs related to the core competencies. So please do continue to share your questions and your input related to any of these resources with us. That really helps guide us as we pull together these pieces and think about what might be most useful. We are also exploring developing additional resources and tools that support use based on feedback from the public health community and other needs identified. So we got a lot of feedback about these types of things as we went through the revision process. I would really like to continue to hear your feedback about what else would be useful to you as you're working with these resources. So a couple of things that we have heard so far and that we are thinking about or kind of exploring what we might do are resources related to job descriptions and kind of identifying priority competencies for different types of positions, or creating some type of resources related to health equity. Don't necessarily know what they are yet. So we are really in the early stages of thinking about these. Would certainly love any ideas of what might be useful to you in these areas. In addition to resources and tools, we'll be offering additional opportunities to learn more about the revised core competencies, events like what we're doing right now. And we are always happy to answer any questions or provide any guidance as you're working with the competency set. So that is our quick overview of the new competency set. And we will, as promised, have lots of time for questions and discussion. And just before we get into that, we're just interested in your quick reaction to several of the resources and tools that have been brought up or either exist now and could be updated or have been suggested to us as good ideas for things to build. So we do have a final polling question here, and Abdul will pull that up for you. But we're just curious what types of resources and tools would be useful to you as you're working with the core competencies. And please feel free to pick as many as you like. And if you have other ideas, things that we didn't put in the poll, we'd love to hear about that in the chat box as well. Awesome. So we'll give people a few seconds to fill that out. Great. Awesome. I'll give it just a few more seconds. So here we go. Close that, share the results. Excellent. So it sounds like the idea, or looks like the idea, of developing that kind of brief video or slides to just provide a little bit of introduction to the core competencies that you could then take and use and adapt for whatever you're working on would be really useful. That I think is the winner in the poll, followed by examples of how organizations are using the core competencies, that's a great one. I feel like that one comes up a lot. And we have worked over the years to try to build a collection of examples, and can look at how we might update that as organizations start using the new version of the core competencies. Competency assessments, as well as tailored lists of priority competencies for different jobs. Awesome. Thank you so much. That's really helpful. Okay, so with that, we have time for questions and discussions. I'll pull the slides down just so you can see our faces a little bit easier, I guess. Please feel free to continue to put your questions and your comments in the chat box. Or if you would like to ask a question out loud, please feel free to raise your hand and we can unmute your phone line if you'd like to speak. So I'm going to kick it over to Ron really quick and see if we have any questions so far.
We do. Some comments, some questions. There's a comment about that simplification is a good goal. And that reorganizing in a way to make it less daunting for people is good. And I think hopefully you'll see that in the self-assessment tool that we did put in the chat box. But here is a question for you, Kathleen.
Okay.
And it's about the crosswalk for the, I'm sorry, not the crosswalk. It's about the prioritization process tool. Are we intending to update it, and when might we be intending to update it?
Well, that is a great question. I think it should be updated. Do you guys think it should be updated? Janet's a thumbs up. It's definitely on our list. We haven't started that one yet, but it's definitely on the list of things that I think would be useful. So if people have thoughts about whether that's actually useful, we'd love to hear that. I don't want to update something that you all never use, but it's definitely on the list of things to be updated. I don't have a timeline yet, but we could follow up on that.
Sure. And Kathleen, a question that we often get that I'm not sure what the answer is to it is about CEF and how they use the core competencies rather than just saying they use them. Do we know how they use them?
Oh, that is a great question for
I put the answer in the chat. I mean, my interpretation is that, the core competencies really reflect much more on practice skills, and CEF has to balance academic skills with practice skills, which is why they don't use ours just directly. They have to have a balance in there.
I do know that, and I don't know exactly how the process worked. This would be great to find out more from CEF, but yeah, I do know that when they developed the foundational competencies that are in the accreditation criteria, they did look at a number of different resources, competency sets, and things like that. The Framing the Future initiative was going on, I think, at the time. And so I know there was like a crosswalk built out with different, with the core competencies and other types of resources and how they map together. And so I know they had quite a process in putting those together, but I don't know all the details, sorry.
Yeah, I was just exiting actually the council at the time when they were going through that, and they did a number of blue ribbon panels. They did a process very similar to what you all did. They, put them out there and said, what do we need to do? The council itself also discussed, what they needed to do for their competencies. But Janet's right, the core competencies are meant more for practice. And of course, CEF took all these other competencies in their own blue ribbon panels and got a lot of feedback. And of course, most of the feedback was from academia, but they went through a similar process as well.
I mean, to their credit, you can see the most recent revisions, the CEF revisions have a much stronger emphasis on practice, which is hallelujah, and we haven't seen yet how they will adopt or adapt to the new set of competencies. But watch this space.
Oh, sorry, go ahead.
No, I was going to say we have lots of other questions, but Kathleen, dive into
Oh, I was just going to say that CEF is a member of the Council on
Yeah.
Linkages, so we do work with them regularly and have discussions about this kind of stuff. And I noticed, I haven't followed the entire chat box, but I noticed a couple people put some recent comments, I think, that are related to this as well. So like the applied practice experience and things like that. So yeah.
Right, and we should mention the National Board of Public Health Examiners that does the Certified in Public Health certification for individuals as part of the Council on Linkages as well. So there is that good discussion and interaction,
as well as the Public Health Accreditation Board.
Right.
So, right. Yeah, so the Council on Linkages does become a nice space to make sure that as much as possible we're aligning things and coordinating things, and or just not contradicting each other. You know, there are different twists on different pieces, but to the extent that we're moving in the same direction, I think that's valuable. And so it's nice to have all the groups, you know, have a space for the groups to come together and talk about such things.
So there's a comment about the importance of health equity. And acknowledging we do have a health equity domain, but is there a way, and I'm thinking maybe it's in the way we define the domains, to address health equity or have some statement about health equity that may be in all domains?
Yeah, that's a great point. So we did, and Amy, maybe you can speak more to this because I know you were part of that. So we had a subgroup that focused specifically on health equity as we went through the revision process, because it obviously came up as such a huge area to really look at and think about what we were doing and how we were presenting things. Obviously with the revision of the essential public health services, to really focus on that too. That guides a lot of what you see in the core competencies, because the core competencies are meant to be the skills to deliver the essential public health services. So we did have a lot of dialogue about that, and there is, at the end of the day, a health equity domain was built out specifically, but also health equity content was woven throughout the other domains. So really trying to better reflect that across what we do, and not just sort of silo it off into one specific place. But I don't know, Amy, if you wanted to say anything about that.
Yeah, as Kathleen said, it was a really big discussion. We went through back and forth. Okay, should it be in all the domains? Because it's really a cross-cutting kind of competency. But you could say the same thing for some of the other subject areas too. You know, like preparedness, you know, we were talking about how a lot of that kind of infuses a lot of the other other domains as well. So at the end, we went with the decision to concentrate it in this one area, knowing that a lot of the examples that we may be having through some of the future tools that are coming out will have some of these cross-cutting pieces infused throughout the rest of the other domains.
Awesome. Yeah, and we have started kind of initial discussions of like, what resources can we build out to accompany the core competencies to provide more assistance? Health equity, I think, as we were going through the feedback process, came up as an area where a lot of people or a lot of organizations expressed, you know, kind of that they knew they needed to be doing something, but they didn't really know what, and could we provide some additional guidance on what the what is, sort of. And so we've started having some initial discussions about that, but it would be really helpful if people have ideas or suggestions of things that would help in that area. We'd love to hear that and be able to try to pull some pieces together.
So I'm going to take the next question.
Okay, great.
It's about performance management. Would like to more tools to align with performance management, the core competencies with performance management, and a couple of thoughts about that. One is that you know, first off, it depends upon how the organization is using the core competencies. If competency gaps and ways to address those are integrated into the strategic plan of the organization, through the workforce development plan, that's a good way to get started on how do you now integrate it into performance management. So that's, you know, something we could think about. Are there any examples that we can come up with and put on the website? The other part I would say is, you know, at the organizational level, again, you have your strategic plan, your workforce development plan, your performance management system. But then when you get down to the individual level and working within divisions within an organization, you'll have workforce development strategies there as well. And depending upon what goals you establish, that will then determine the measures that you establish. So Kathleen, Abdullah, Grace, let's note that, see if we can come up with some examples.
Yeah, great.
There's a question about a roadmap for implementation of the core competencies, or a request. Is that something we might consider doing?
That sounds kind of cool.
Yeah.
Any thoughts on what would be in it, or like things in particular that you'd like to see?
I think that should all be part of a toolkit. You should have like,
Neat.
like
might
starting
even-
out with that. And
You might want to have like a case study too
Mhm,
of somebody who,
exactly.
an organization and how they implemented.
Mhm.
Exactly.
And we have done a little bit of that previously. If anyone is, this would be the 2014 version of the core competencies, because it has not happened in the last couple of months, but we did quite a bit of work with Denver Public Health. It's now the Public Health Institute at Denver Health. And they mapped out how they implemented the core competencies. And we have an archive webinar that kind of described the process that they went through. But yeah, I think all of that stuff would be really interesting.
And are there any strategies for interweaving the updated competencies into the education of advanced practice nurses?
Ooh, that's a good question.
There are the public health nursing competencies that always are modified to match the core competencies. But my answer, and I teach a lot of advanced practice nurses is just to make sure that the content is interwoven into that curriculum. I mean, that's like the biggest step you can take. And then, so that's, but there are the public health nursing competencies out there.
Yeah, there are a set of competencies that come, you probably are familiar with them, but come from the Council on Public Health Nursing Organizations that are public health, community health nursing competencies. And those are designed to be aligned with the core competencies for public health professionals. So when we update ours,
They update, yeah.
updated as well. So I haven't heard anything about the process at the moment. If there are any plans to update, I know they recently completed their previous revision, and so I'm not sure what their updating plans are, but those competencies have been very closely aligned in the past. And as we build out all these crosswalks, even to the extent that we need to do some of the mapping ourselves, even if during the process before other competency sets get updated. I think.
Yeah, and the big difference there is that they map out they use our competencies, but they look at it from the population level and the individual family level. So they look at both sides.
Nice.
So here's a question, Kathleen, that I'm going to throw to you.
Okay.
Has anyone ever developed a core competency assessment that is knowledge-based instead of competence-based?
Oh, that sounds like a scenario-based assessment.
Yep. Mhm.
This kind of assessment, so the idea of building out a scenario-based assessment that would, essentially ask you to go through some kind of scenario, and based on how you performed or answered questions or whatnot, would judge whether you'd attained competencies in certain areas. Has been discussed as long as I've been at PHF, which is over a decade now. I've yet to see one actually be developed. We do not have them. They tend to be pretty difficult, I'm told, to develop. I don't know, Ron, if you have any additional thoughts on that, but I know there are groups that have tried, but have not it's never come to fruition as far as I know.
Well, I wonder what the CPH, the Certified in Public Health exam, I know they probably use the competencies at, the older version, I'm sure. But I mean, that's an attempt at a knowledge-based assessment.
Yeah, it'll be good to look. They do, so they have a job task analysis. So it's kind of the core competencies are woven in, but it's not exactly the core competencies.
Yeah, yeah.
Yeah.
I mean, they're more probably based on the C competencies, but
That's a good question. I don't know.
yeah, I mean, it might be interesting to kind of crosswalk to see.
Yeah.
Well, you know, I mean, the goal in using the core competencies is proficiency anyway. And so when people rate their experience, knowledge is really just the awareness and knowledge are sort of the lower side of the skills. I know you're talking about different kind of knowledge survey, but that's, I mean, we really are aiming more at finding out, you know, how proficient somebody is. Someone might know something, but doesn't mean they can do it.
So there is a question, excuse me, about the competency assessment. If we're going to develop a new one, we put that in the chat box earlier. If there's something in addition to that that you were thinking about, please let us know. Either you can raise your hand or put it in the chat, and maybe somebody could Abdullah or Grace, you could paste it back in. The assessment. Okay.
Yeah, that would be great. So there is the general version is available now, which includes just the competency statements. It doesn't include all of the sub-competencies. So that is currently available. And then the other three, one for each tier that includes the sub-competencies for the specific tier, are very, very close to being finished. So yeah, those are going to be the first tools that are done, I think.
Great.
Yeah.
And this is for anybody. And I suspect several of you may have thoughts about this. Any ideas about how to use the core competencies in succession planning?
Ooh.
Well, I'm going to chime in there. The whole idea of developing the tiers, or I mean, I know we have problems with the word tier because it implies levels, but is that having that continuum, someone can look across and see where they need to go to build skills, to go from, you know, working frontline and community, which is important, but to the executive level. So that's how I've always seen it when I've been asked about succession planning, that it helps to look at what your staff needs to know in the future.
Mm-hmm. Yeah.
So there's a question about our definition of public health professional, and I'll take this one. You know, would it include professionals that might be outside of formal governmental public health, such as those who work in social determinants of health? Absolutely. This is meant to apply to individuals who are in public health as they define it, and population health clearly is part of this. So we'll move to the next one. I'm trying to read this one here. These competencies are public facing. To what extent has the group discussed internal facing competencies, such as peer interactions, communications, and collaborations? And I think, I mean, I'll chime in quickly on that. I believe that the competencies themselves deal with the internal as well as the external. Communications is a big part of this, both within the organization and outside of the organization. So maybe if there's something we're missing in that question, you could raise your hand, speak out, or put more in the chat box for us.
Right. And we talked about managing teams, and we have that in there.
I am looking through the chat box here.
I could be doing the same thing.
A couple of comments about.
Oh, like soft skills. Yeah, there are a number of, I would say you'll find most of these things in the management domain, the domain 7, so close to the end. But things about, I don't know, communication, team building, professional development of your staff, sort of interpersonal interactions, like don't know what the right word is. I'm blanking on the words. But kind of like managing conflict, managing change within your organization, things like that, if that kind of gets at some of what you're thinking. Facilitating communication among different people. What else can kind of like more internal, isn't really soft skills, but like the internal kind of contingency planning and things like that, strategic planning.
I think there are maybe a couple in the health equity domain too that were internal facing.
Communications, the strategic planning stuff is within, depending on whether you consider that internal or external, I feel like it's a little bit of both, but is in policy and program development. So, but I would say the management and finance domain is the most of all the domains, probably the most internal facing, budgeting, things like that.
Right. And there's some under systems thinking and leadership too, you know, ensuring a skilled workforce and providing opportunities for staff for lifelong learning kind of thing.
And I see a question about the competencies in train. I know, Kathleen, you mentioned that earlier about the crosswalk, and yes, that the new set will be integrated into train once we complete the crosswalk and do the programming. And when I say the programming, what will happen there is there will be an automated process where the courses already in train will be matched up with the new set of competencies, and course providers will be alerted to that so they could go in and check. But we'll be doing it in an automated way to make it easier on both the course providers and learners. Some more suggestions about the roadmap.
Oh, cool. Nice.
And thank you for whoever on our team shared the Denver webinar. It seems like a few folks wanted that. Let me see here. Are there other questions people might want to ask orally? And it is very conceivable and highly likely that I missed some questions that people put in the chat box. So please excuse me from doing that and add it back in. If you don't
There was a
mind.
question about using the core competencies for the applied practice experience in schools of public health, which is one that we've often said, this is really where the core competencies work really well in academia, because as the name implies, it's a practice experience. So I don't know if that answers the question, but that's certainly something that a lot of schools recognize.
And it looked like somebody put a comment in earlier, and I have to find it, that they've already used the new set of competencies for assessment purposes and chose, let people select certain domains to respond to, but the health equity one was required for everybody. I'd love to learn more about that and how that went, if whoever put that in there, and my apologies for not looking at the name. If you talk a little bit about that, because we love hearing about the new experiences and the use of the competencies.
And while we get any additional comments there, I will circle back. I see there's a comment that the internet froze up, so they may have missed this. So I will just circle back related to the CEIF competencies. So there is not currently a document that aligns the CEIF competencies with the 2021 version of the core competencies, although it's definitely something that we've been thinking about. So again, if stuff like that is useful, please feel free to let us know. The previous version of the core competencies was used in determining the foundational competencies that are found in the CEIF criteria. But obviously the revision or the competencies that exist in the CEIF criteria predate the revision of the core competencies. So we can look at kind of connecting those dots a little better as well.
Now it looks like Christine has her hand up. Christine, did you want to make a comment?
We unmute her. All right.
Oh, here we go.
Is she?
Yep.
Oh,
Here we go.
Just unmuted.
go ahead. I think-
And Carmen identified the originator of the comment that Ron, you were talking about. Janine, I'm not sure I can
Arigi?
pronounce your last name. Arigi?
And we
Great, so
always
yeah,
know
we
that
can follow up.
people can't stay on the webinar the full time as well. So we can follow up. We have,
Yeah.
Yeah, that would be really interesting to learn more about.
and I'll, given the richness of the questions, the comments, the suggestions here, I encourage all of you, as you're using the competencies, to let us know how it's going. Let us know what questions you have. Let us know what's working, what's not working, because we're always looking for ways to provide better guidance. And the best way to do that is getting feedback directly from those who are using. So please, please, please provide us with that.
And obviously the PHF folks can provide lots of information, but I get a lot of people contacting me because I'm in academia about the academic questions. And I'm sure Amy does too. So if you're in academia and you're trying to work out the CEF issues and whatnot, I'm always happy to answer questions based on what we did here and know what other schools have done.
And I just saw that Janine put her email address in the chat box if anyone wants to learn more about that. So thank you, Janine. Please do share, as Ron said, your reactions, your questions, your suggestions, your concerns, your experiences as you're going through this. All of that helps inform the work that we do, the support that we provide to other organizations. And so it's really helpful, not just for us, but for everyone else out there in the public health community that's trying to do the same thing, to the extent that we can connect people and help facilitate those conversations and people learning from each other. We always love to do that. And let's not all do it in isolation if we can work together on things. In that vein, I do have I don't know, Ron, if there's any other questions. I do have a couple slides really quick at the end. This just have some links. That maybe I'll just put the slides back up really quick. And please yell if you can't see them. But we just wanted to, again, thank you all for this discussion today. It's really fun for us to hear what's going on. And as I mentioned, it's great to hear where there are opportunities, what resources are useful, so we can really focus our efforts on the things that are going to be most beneficial to you. So I wanted to just close by inviting you to stay connected. The revision is over, but that doesn't mean this work is over. And as we continue to build out resources and tools and look at opportunities to support better support implementation. So everything, the link here for the core competencies will connect you with all of the core competency stuff that's on our website. And we have several newsletters as well, where we regularly share information about the core competencies. The Council on Linkages update, obviously being the most focused on Council on Linkages activities. And kind of anytime there's a new resource, a new tool, a new webinar, you'll find that there. And you'll see major milestones and events shared through these other two newsletters as well. So if you're not already subscribed to them and would like to be, these links will allow you to do that. And maybe, I don't know if we put the slides back in the chat box. So yes, awesome. So if you want to grab the slides from the chat box for these links, you can do that. And as Ron mentioned, please feel free to share your questions, suggestions, anything related to the core competencies. Please feel free to reach out at any time. And then on this almost last slide, other than the thank you slide, is just kind of one place where we have all the links to resources for your work with the core competencies. The Council on Linkages website contains information about the core competencies, as well as other Council on Linkages initiatives, such as the Academic Health Department Learning Community. The core competencies obviously are available online, as we've just been talking about, and all the tools and resources as those get built out are up there too. So there is a link to tools right now. It should note at this point that these tools are pretty much based on previous versions of the core competencies as we go through this process of updating the resources and tools, but updated versions will be accessible from that link as they are developed. So please feel free to explore and let me know if you have any questions or I can help you find anything. So with that, this is the last slide, and we'd just like to thank you once again.
Thank
We really
you.
appreciate your participation. Please don't hesitate to reach out to us. Thank you so much.
Thank you.
Have a good rest of your day.